Are all bleeding during pregnancy implantation bleeding? Are all bleeding during pregnancy implantation bleeding? Good day everyone and welcome back to Nurses Lecture Room YouTube channel. My name is Mary, popularly known as the Nurse with the Difference, and I make learning easy and accessible for all my viewers. Today I'm going to be sharing with you the causes of bleeding in pregnancy. The causes of bleeding in pregnancy. A lot of people have abused the term implantation bleeding and they don't really want to go to the hospital to find out what is wrong. But before we go into details in today's class, if you are new on our YouTube channel, please click on the subscribe button, turn on the notification bell so you don't miss out. For all my returning subscribers, this is Nurse Mary saying thank you. Let's go there. Alright, welcome back. Like I earlier said, today I'm going to be sharing with you the causes of bleeding in pregnancy. Before I go into details, I just want you to know that this video is not a type of video. I'm not making this video to tell you this is what is wrong with you. I'm just making this video to educate you, to get a more definite diagnosis of what is wrong with you. It is better for you to see a doctor or a physician for a definite diagnosis. So I'm going to be sharing with you all the various causes of bleeding in pregnancy. So the first one I have to share with you is implantation bleeding. Implantation bleeding. Most people call it spotting because it's not really bleeding per se. It's not heavy when compared to your menstrual cycle, or your menses. It's not heavy, or it's not plenty. Let's use the local language. It's not plenty when it comes to your menses. What is happening, what results in that implantation bleeding is the fertilized egg trying to take position in the womb. The fertilized egg is trying to implant itself in the uterus, trying to stay in the uterus. As a result of that, you might get that implantation bleeding, that spotting. So that is the first cause of bleeding in pregnancy, which is implantation bleeding I've just explained. Then the second is miscarriages. Miscarriages can cause bleeding in pregnancy. Miscarriages can cause bleeding in pregnancy. There are different types of miscarriages. We have the threatened miscarriages, we have the incomplete, we have the complete miscarriages, and we have the inevitable miscarriages. In terms of the threatened miscarriages, most threatened miscarriages does not lead to loss of a baby because the cervix is still intact and the baby is still intact. There's no danger done to the baby and the cervix. In threatened miscarriages, it's a threat. It's not the main thing that is happening. Then the second type of miscarriages, which is inevitable, the third, incomplete, those ones might lead to the loss of a baby. Those type of miscarriages might lead to the loss of that pregnancy, might result in abortion. So in such a case where you are having bleeding in pregnancy, it's advisable you see your doctor. Then the third cause of bleeding in pregnancy is ectopic pregnancy. Ectopic pregnancy. What is ectopic pregnancy? Ectopic pregnancy is a type of pregnancy in which the fertilized egg stays in the fallopian tube. The fallopian tube. You see the picture of a female reproductive system. That fertilized egg ought to be in the uterus and not the fallopian tube. So when the fertilized egg stays in the fallopian tube rather than staying in the uterus, that can result in bleeding in pregnancy. We all know that the fertilized every month, the uterus is prepared to welcome a baby. The uterus is more have the required blood supply, have the required membrane structure, everything in place. But the fallopian tube does not have what the uterus have to accept or withhold or hold a baby. So when it happens in the fallopian tube, that can result in rupture, in bustage. Let's use that local man. There's nothing like bustage. That can result in rupture of that fallopian tube, and that will result in bleeding in pregnancy. That is actually a medical emergency that needs to be sorted out as soon as possible. Then the last one I have to share with you that might likely cause bleeding in pregnancy are pelvic organ problem. When you're having some pelvic organ problem. So these are the various causes I have to share with you when it comes to causes of bleeding in pregnancy. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all our returning subscribers, this is Nurse Mary saying thank you. Bye and see you in our next video.